All right, everybody, welcome. My name is Mel. I I guess I'm the founder of Mommy Berries, and it's funny. Mommy Berries actually started. Well, it started because there's holes in care for postpartum women, and I was finding that so many women were coming in, and I'm going to introduce Kareen a bit, and I know she's going to nod because she's going to notice all of this stuff too. I noticed they were all coming in postpartum, months, years down the road, and always like, why didn't anyone tell me about this? So Mommy Berry started just as a postpartum program that I felt would help women get off to a good start and just understand what happened to their body when they had a baby, understand how to gently progress back to exercise and how to get back to higher level exercise more successfully. This community came because I wanted the women in that postpartum program to feel supported and be able to ask questions. But their questions never stopped because once we learn a little bit about our body, we're like, oh, tell me more. And so if you haven't checked out that program, if you're an expecting mom or you're a new mom, please check it out. You'll see a link to my website at the top of this community, and it's called From the Inside Out. Check it out. I think you'll really like it. Through that community, I've been able to add some other therapists and professionals to help talk about some of these topics that we just don't talk about and nobody asks us about. And today we're going to talk about sex after baby. I'm lucky to have Kareen with me here. Kareen is a therapist that also works in Kelowna, the same community that I do. I've always looked up to Kareen and all of her wisdom, and I was so lucky when I first moved here. She's always been so willing to kind of help me learn. And so I reached out to her right away when I wanted to talk about this because she's so open about this topic. And I think it's important for you to know that you're not the only person out there having questions or concerns, I guess, about getting back to sex after having a baby. This isn't exactly something that we walk around talking about. If someone doesn't ask us, it's not something that we're like, hey, tell me about this, or like it hurts when I have an orgasm, or I can't get anything in there. And so actually, before we go, I would love for any of you guys, like, just as you're watching this, let me know, has anyone ever asked you about sex or given you advice, like in some of your postpartum appointments? Has anyone ever asked you or told you about any of this information? Please do comment, because I would love to hear if you're getting that. Kareen, without further ado, I'm sorry to yak so much because I want you to spend most of this time talking. Why don't you just really quickly let people know kind of a little bit about yourself and first of all, just where people find you?
Yeah. Yeah. So, and I was laughing with Mel because I'm not very techy. So at the bottom of my screen, it says Anora, and that's my daughter because she also uses the Zoom. So sorry if that's confusing, but my name's Corrine Wade and I own Care Physiotherapy with a K. So it's spelled Kare in Kelowna. And I've been a pelvic floor physio for 25 years. So I went to school in BC, Canada, and then lived in the States for a few years. And that's where I got a lot of my training because at that time, many years ago, nobody was really doing pelvic floor work in our community in Kelowna. And so when I started doing it in the US, and eventually moved home, I was like, oh my God, like this is such a need. And I originally started in pelvic floor work as from a sports perspective because I was in a sports physio kind of model. And so I'm really glad that I was able to kind of meld the sports physio kind of part with more traditional pelvic floor work, which is prenatal, postnatal. So yeah, I feel lucky I'm able to treat lots of athletes, lots of moms, men, teenagers, like all ages. And I think as pelvic floor physios, we're so lucky we get to treat men and women throughout the lifespan. So obviously today we're talking more about women, but I think Mel too, like I am so passionate about making sure this information gets handed on to our daughters.
Absolutely.
So important. And women that maybe are thinking in the future of having a baby, right? So Mel and I, we do a lot of work at saying, hey, do not just wait till you're pregnant to think about pelvic floor. It's really important to think about it even before trying to think about fertility, right? Like it's throughout the lifespan. So today we're talking more about, postnatal. But yeah, we love your comments and questions. If you have daughters or you have sisters, aunties, whatever, I think it's important to Think of
Absolutely.
it as the lifespan, right?
Absolutely, because I think that, and that's why I think that's why I like this platform, being able to talk about this information. Because if you just learn to talk about it and not make it so shameful or not make it so embarrassing, then it does get easier to just talk about your daughter. When she brings it up, you don't feel so like self-conscious about it. You don't feel so nervous. You understand it, and it's easier to kind of pass on that information.
Yeah.
And
And
I
even
was
if you catch them masturbating, it's like you don't want to, they've done research to show if you catch your child masturbating and you do one of those, they're going to go, oh, I'm so ashamed. Like, even if they're just little, they just read your facial expression and now you got to undo that.
Absolutely. And I was telling Kareen before I hit record, like I would consider myself a like I'm really comfortable talking about anything, but I would say sex is something that I feel a bit conservative about. I don't necessarily, I feel really comfortable talking to my clients about it on a one-to-one basis, but I think I kind of shy away from talking about it in a group setting. And I don't necessarily know why, but I felt like Kareen was a really good person to bring on here because she does a really good job of this. And I thought we would just kind of talk through chronologically a little bit what happens, you know, with with sex, I guess, and how we get back to that feeling as something that we enjoy doing again after having a baby. And as Kareen mentioned, like this talk today is focused, like laser focused on getting back to sex after having a baby. And I thought maybe one of the questions I get, Kareen, and I wonder how you answer this, is a lot of women say, um, when can I start having sex again after having a baby? What answer do you give them?
Well, first of all, and probably you too, Mel, what I cannot stand and makes me want to pull my hair out is at that 6 week or 8 week visit with the whatever care provider that mom has gone to, whether it's a midwife or doctor. I think it's tragic when the doctor or whoever says, oh yeah, you're good to go, 6 weeks, 8 weeks, okay, bye, go have sex. And I've had women tell me, my doctor didn't even look down there. They checked the baby. They didn't even look down there. So that's my first pet peeve is number one. I think both Mel and I would say there is no perfect timeline. There is no magical number of when you're going to be ready to go back. And actually the research shows even in that first 6 to 8 weeks, probably over half of women, I'm sure it's more, have a lot of pain with intercourse, and even months later and even a year postpartum. So actually it, like, to kind of throw the number out the window. That's what I tell them. That's what I tell women, first of all. Second of all, I ask them, how was sex before you had a baby?
Mm-hmm.
Like, if you weren't having great sex before, right? And I think we don't ask, the doctor never asked that, for one. But I think as physios, I always ask, I'm like, hey, like, how easily could you feel desire or aroused? Or did you ever even really get in the mood without half a bottle of wine? Like, how, how was sex before? Number one. And then obviously taking penetrative sex right off the table. So I think in our culture, we often think sex is penis and vagina sex. And I tell women, no, like it could be oral sex. It could be, an intimate massage. So I try to be really clear with my patients.
Mm-hmm.
When I say sex, what I mean, and usually I think the general culture is saying penetrative intercourse. So first of all, I tell women, number one, it should not hurt. And number two, it's kind of like there's so much fear and so much body image stuff that I think even if you're contemplating having that, most women I talk to, they are so apprehensive about the first time that I think a lot of what we do as physios is before I even lay my hands on somebody, I'm really talking about how do you feel about your body? Like, if you feel like you can only have sex with the lights off because you don't like how your belly looks, or you think your thighs look wrong, or you don't like your stretch marks. So I think there's so much, like, our brain is our most important sex organ. So I don't think it's only about the vagina, right, as to whether it's ready to be penetrated. And I think as women, we have to be ready to receive it. So I talk to a lot of women about when you feel ready to receive something, even if it's a finger on the outside. So I think that's the first thing is number one, throw the number out and throw the penetration out the window first.
Totally. And I think like as you were talking, I was like, of course, like there's not like, first of all, I think if you don't feel ready, then you're just not ready. Do you know what I mean? Like, I think that like you'll start to be like, oh, maybe I could entertain the idea of that. But there's so many things going on. Like, it is not just physically is my vagina ready, but like you said, like emotionally, do I feel, like you said, can I accept something or can I receive something? And how many, like, I definitely was just like, there's someone clinging on me constantly. I just can't, like, don't even touch my shoulder when we're sitting beside each other on the couch. Like, I'm just not ready for that. And I would love for who else found that, because like, hands up if you found that, because I think that's what a lot of people are like, I'm just not, you can tell they're like, I'm just not ready to even think about it. And I think that you have to be ready, like you said, emotionally, physically, and you have to be in the right headspace, because otherwise your body's not going to be in the right headspace. And so I think that, like you said, I think it's important for peace of mind that, you know, you can acknowledge what's gone on with your body, and maybe work with what, you know, talk to your doctor who's looked at it, your midwife has looked at it, or your therapist to at least talk to you about your body, because I think it helps to understand. I think we have visuals in our head about what our vagina looks like. And for someone to be like, listen, you actually look very normal. And this is just muscle and this is tissue, and we're working through the process of recovery. And so to put peace of mind, but like you said, there's so many different factors there
And
to
even stress and
consider.
sleep. So I love, one of my favorite books is written by actually a UBC female researcher. Her name's Lori Brotto. And so this is a popular book, obviously, right now in the physio world. And so Lori Brotto wrote this book about mindfulness for sex. And what's interesting, she said in her research, 1 out of 3 women, this is like before you even have a baby, 1 out of 3 women have low libido, low desire, purely from stress. And she did a research program where all they had women doing was just super easy peasy basic meditation to learn how to cultivate desire. So I think as physios, obviously Mel and I, of course, in our sessions with women, we are looking at the vaginal opening, we're looking from the outside, and if appropriate, if it's not too painful, gently, like 1 finger, we're not using a speculum, right? That's what's scary, I think, at the doctor's office. That as physios, we're actually like checking the tissues and checking the muscles and helping someone in that first 6 to 8 weeks postpartum, so that we can tell them, okay, from the muscle point of view and the tissue point of view, and how is your pelvic floor working, that's just the muscle piece. But again, if you're not getting adequate sleep, or you're so stressed out that you just want to scratch someone's eyes out, I don't think sex is going to be very fun.
Exactly.
So I think it's kind of, as physios, we look at the whole person. And if your nervous system is sensitized, if you hear a noise and you go, oh, and you jump and you're just on edge all the time, sex is probably not going to be fun. Even if you have the most perfect pelvic floor and you had a C-section, because lots of women that in the research, the number of women that have pain postpartum, even if you have a C-section, is just as high as vaginal births. And that could be from adhesions, but you know what? I think it's the stress of being a mom.
Totally. And that leads me to what my next question was going to be. And I think I always say, like, women come in and I think they have this visual that after they've had a baby, that their muscles are flapping in the wind. Like that they always, like, women always have visuals of like their partner not being able to feel any tone, or that everything's going to be loosey goosey. But when they go to have sex, like whether, like you said, after vaginal birth or C-section, they're like, oh my gosh, nothing goes in. Can you kind of speak to that a little bit and explain like why that's so different than what people are expecting?
Yeah, so I think as physios, something Mel and I would do in a first assessment with someone postpartum is looking at their pelvis. So maybe the bones are out of alignment in their sacroiliac joint or their back, or maybe their abdominal muscles split. So their whole pelvis and core muscle group area is not even holding itself together well, or their ligaments are unstable. So the pelvic floor muscles may be gripping just because that postpartum body from ligament laxity, still breastfeeding, it's only 6 weeks postpartum. So sometimes the muscles are tight, again, not just because a baby came through there, but the muscles are holding, trying to stabilize the pelvis. So what Mel and I would do in a typical first session is check alignment, right? Check, are the hips and SI joints able to move? What's the low back doing? Can the person move their rib cage? And as moms, right, all the carrying and lifting and breastfeeding we're doing, right? So I think the muscles obviously can be tight for different reasons, but that's what we work on in pelvic floor physio. And then obviously checking for vaginal dryness and vaginal atrophy. So hormones obviously are a big role, and that happened to me postpartum after my 14-year-old was born. My labia shriveled up to little thin, like it was depressing. And even the color of them were like a pale pink. So I think that's important, right? That when you're breastfeeding, your estrogen levels can go down quite significantly, enough that I had hot flashes. So I don't know if you guys in the community have experienced that, right? If you're getting hot flashes and your lubrication vaginally is quite dry or non-existent, you don't have anything on your underwear compared to when you're pregnant, everything's juicy, right? So if vaginal dryness is the reason you have pain, and you go to someone like Mel or myself that says, oh, guess what? On top of you having no lubrication, your muscles are tight. Now you've got a double whammy of lots of friction, which creates pain. And then every time that hurts, you're going to tighten up more. So what Mel and I would do in a typical physio session, right, is we're breaking down, okay, chicken or the egg, or maybe both these eggs are happening at the same time, and we're just trying to so Mel and I, we would educate people, and we could talk about that, about lubricant. But again, it's kind of figuring out why they're tight, right?
Totally. And I think that that's important. Is like, you're probably going to have a combination of, so far we've gone through like stress, overwhelm, not enough sleep, the nervous system just kind of being like overwhelmed. And usually you're not going to feel relaxed and juicy for that, right?
Yeah.
In combination with a bit of a shock to the system from having a birth, whether it be C-section or vaginal birth, where I would say the muscles often respond with tension, again, making it harder for something to go in. Hormonal changes, which create like a sense of dryness or friction, which also doesn't feel comfortable, and just not feeling like we're in the mood. When, Corinne, go back for a second, because I was going to ask you, like, one of the things that I think a lot of women do seem to know, I have to go get lubrication. I think that they're getting that information from someone, whether, I'm curious to know, you guys, who did you get that from? Did you hear it from your friends, your care provider? Who told you to use lubrication and that you'd be dry? Because everyone seems to know that, right? But what do you suggest? I tell people to experiment with lubrications, because I have found that some of the over-the-counter ones that you just buy at the pharmacy don't have the right consistency, right?
Yep.
And I actually reached out to a bunch of different companies that sell lubricants to send me some samples, and I've kind of just been trying them and giving them out to clients and getting their opinions, and I've noticed a big difference. What do you suggest? I don't feel like I have a good quality answer, and I know it's very individual, but
Yeah.
what do you usually suggest for lubrication?
So what I tell women, and I can send you a couple of the resources. So number one, what's interesting is the World Health Organization says that the osmolality of the lubricant, and that's the concentration of particles in the lubricant itself, should be no more than 380.
Okay.
And I can send you a link with a chart with a whole bunch of lubricants. So this is what drives me cuckoo bananas and wants me to make, I want to punch somebody when I hear this, but one of the worst lubricants you can use, according to osmolality and pH, and we'll talk about optimal pH balance, is called Replens.
Yeah. It's one of the worst?
It's one of the worst. So I actually wrote it down. So if the World Health Organization says it's supposed to be 380 or less, Replens itself is 1,491. So essentially, if the osmolality is too high, it'll literally suck moisture out of your tissues.
Wow.
Right? So kind of like, remember chemistry, when you'd have a glass of water and the chem teacher would say, hey, put in 1 tablespoon of salt, 2 tablespoons, 3. So that's the concentration of that liquid. That's all osmolality is how many particles did we put in the solution. And what's really brutal, and not that most women postpartum are going to use a tingly, warming, cinnamon kind of lubricant, but they're, let's say, KY warming jelly. On the chart I looked up, 10,300 is the osmolality. That's 27 times. So that will just suck the moisture right out. Isn't that mind-blowing?
Yeah.
Even KY, common, right? It's got 5 times the osmolality.
And that's exactly the one I hear most people saying, I have KY. And I feel like they used to send that home in the hospital bags. Like, I think when I had my second, that's what was sent home.
And Astroglide is really bad too.
Yeah.
So what I recommend, so for optimal osmolality, I love Sliquid. Mm-hmm. London Drugs even sells it. I know what I love about.
Okay, good to know.
Yeah, and Sliquid has a whole range of products. They even have an organic line, but they work really hard to not put any parabens, which are not great for your body, or phthalates, or sugary stuff. A lot of them use glycerin, which is kind of makes it sticky. And that's, so the pH, the reason that's important is the lactobacilli, the good bacteria in our vagina, right? Your vagina's most happy pH is like from 3.8 to 4.5, so around 4. If that is not optimal, then you could be higher risk for bacterial vaginosis, yeast infections. Well, guess what? You go shove something in your vagina that's got the wrong pH, not only is it going to hurt, so if I have women that already have painful vaginal tissues from endometriosis or vaginitis or whatever, I am not telling them to go put any of that bad stuff on. It's just going to make it worse. So Sliquid is awesome because its pH is right where you want it to be, and the osmolality is awesome. There's another one called Good Clean Love. That's a common one that's nice too. I don't know where you can get Good Clean Love in Clonidal, so I'd say Sliquid I really like. And obviously if you're having anal sex, so not most women are going to be doing that at 7 weeks postpartum, but then I recommend more of a silicone-based lube, because for your rectal tissue is very sensitive, and yeah, so we can talk about anal sex some other time. So not that most moms are going to want to do that, but yeah, it blows my mind that often what the obstetricians are recommending is your cleanse.
Yeah. Okay.
Yeah.
I think that's,
yeah, but I can send you information on that. Yeah, so you don't want stuff with a bunch of flavors or cinnamon or warming or any of that crap.
maybe I'll get you to, when we're done, I'll get you to comment in the bottom with like some of your favorites, because I think it'd be a good place, like people can look for where they can find those.
Sure.
What do you say? And I always talk to clients when they're like, I think I'm ready. We've talked about the lubrication. We've talked about how the pelvic floor fits into it and how they can learn to control the muscles, like how they understand, okay, I'm about to have sex. I'm feeling a bit of anxiety. I can feel my muscles tense. That's okay. I know how to relax them. I know how to visualize that. I start talking to them about positions. And you know what I often say is, first of all, I say there's no right position, but I usually, and please tell me what you say, because this is just what I say try to find a position where you're in control. Like you can control the depth and the speed, because then you take out that variable. Sometimes partner doesn't know, they're excited and they're going fast or they're going deep, and you're just not ready for that. I usually suggest try to be in a position where you can control that. And obviously, there's lots of different factors, but what is your advice? Let's say that the woman feels ready and she's interested in trying, and she asks you, what positions do you suggest they start with? What would you say?
So the first thing I say is it depends what's going on for them. So let's say if they have prolapse, then I'm going to tell them you don't want gravity adding to the downward pressure. So I tell them like head down, bum up, which might be like in a bridge with pillows under their bum. So let's say if someone has prolapse, I have a specific set of positions that might work for them. And kind of like what we said before, I'll ask them, what positions did you like before? Right? So those might be your go-to. But if they're tight, if their pelvic floor muscles are tight, then obviously I don't want them in a position that their legs are going to have extra muscle tone and the inner thighs are bum. So let's say side lying might be better with a pillow between the knees, right? But you're right, I totally agree. They need to be able to control the position, the depth, the speed. But also I tell women, the research shows it takes 25 minutes of like stroking and licking and touching and foreplay and all that to even just get someone who's never even had a baby to get some blood flow and arousal and erection in the clitoris. So even if you have the most awesome position, it's kind of like a guy. If you're like, hey, we're about to have sex, but that's okay. It doesn't matter if your penis isn't erect. Like that would be ridiculous, right? If some guy's going to have sex, he's like, well, forget that. I'm not even erect. And then, you're going to do some stuff till he gets erect. So as women, I tell women, the tip of your clitoris is like just that little tip of the iceberg. So I tell women, number one, for sure, we're going to look up position. But I say, you got to make sure, whether it's you in the bathtub with a toy for 25 minutes beforehand to get your brain into it, but also to get the blood flow down there, I think on top of the position. So I agree. It could be, woman on top and she can control the depth, but maybe her legs straddling open now makes her vagina feel too open, right? So you're right. I don't think there's any perfect position, but I think it's totally being open with your partner and going, okay, here's the smorgasbord of positions that we have today on the menu. And let's be playful and let's have fun with it. I think that's the thing, is having make it playful and kind of go, oh, okay, no, yeah,
Totally.
cowboy or doggy style not happening, or reverse cowgirl, whatever. Okay, that's not working. Let's try the next position on the list. But lots of pillows, lots of props,
Totally.
right?
And
Yeah.
understand that in order to achieve orgasm, like we need movement and blood flow to our pelvic floor. And I think that that's important. Like to feel pleasure, you need to be able to have movement in those muscles. And so understanding that, like how we talked about at the beginning, that it's totally normal postpartum to feel almost like a lack of movement down there. Those muscles are a bit scared to respond. That's what happens after any area of our body's been through an injury. It kind of goes into a bit of a lockdown. And so you're trying to gently ease movement into there before you go to have like penetrative sex. And so I think that's important, is like, again, to like achieve orgasm or to achieve blood flow, you want to have the area moving, right? I think some of it starts way back, like maybe something we didn't even talk about at the very beginning is a place to start might be to just start looking at the area and touching the area yourself. Because if you feel like if nobody else can touch it, or if you can't even touch it, you're not going to feel comfortable all of a sudden being ready and open and blood flowing to the area. So yeah, I think a lot of things to think about, but understanding that there's nothing horribly wrong with someone that doesn't feel like having sex right away, or that it doesn't feel totally comfortable right away. There's nothing wrong with you. You're actually quite normal.
Yeah, and again, it could be, I tell my patients, yeah, let's just take penetration right off the table. And how about having a sensual massage, or going, hey, let's go lingerie shopping with a girlfriend. Go and have a glass of wine while hubby watches the baby. Like for me, the best foreplay was like, you look after my baby, and
Yeah.
I'm gonna go have a glass of wine with a friend, and I need to get out of the flipping house.
Yeah.
So I think that's so important. Like if you're trying to have sex and you've got laundry all over the place and baby bottles, and you're like, oh my god, I didn't finish cleaning the kitchen, and like that's why women say, oh, hotel sex is the best. Because
Yeah.
you're like out of your normal environment. So even Esther Perel, who's a researcher that talks about how to cultivate desire and excitement in a relationship, that let's say you've been with your partner 15 years, you have to develop a sense of novelty and excitement. So that could be read some erotica, sit in the bathtub, and like whatever stories turn you on. Like again, as women, our brain is so wired to be looking after that baby that you're not even going to be thinking about sex. So you almost have to train your brain. That's what I tell women. You got to rewire it. And if it means getting yourself really excited and kind of fantasizing about that fireman coming through the door or whatever, you have to think of what turns me on. Like I ask a lot of women, I'm like, what's your favorite fantasy? They're like, fantasy? I don't know what you're talking about. I'm like, you know what? You ask any guy, he will off the top of his head give you the first 5 fantasies. If he was about to had 6 weeks to live, he'd be like, oh, well, this is my first fantasy,
Right.
this is my second. So I think as women, we need to train that part of our brain.
Yeah.
So that you can, when it is time to have intercourse, it's not, some of my patients, they go, well, isn't that cheating on my partner if I'm thinking of a fireman when I'm with him? I'm like, no, you have to switch your brain from baby mode to sex mode. So if it takes a bit of I don't know, choose your favorite Hollywood actor, I think as women, we feel ashamed to do that. And you should feel no shame in exploring some different pathways of your brain.
Totally.
Because again, this has to be turned on first, otherwise nothing's going to happen down there. And then that's where most women fake it. So if you're faking orgasm, it's not good.
Absolutely. So I feel like so that's one thing you said, like that would be a sign to kind of, reach out and try to, whether it be read or find help or whatever. Let's say someone watching this is like, okay, yes, that sounds like me. Yes, that sounds like me. And we've talked about some things that they can work towards. But let's say over time, they're not having the desire, or they're not finding the comfort, or they're not finding the pleasure. What do you suggest? Where's the first place they reach out for help?
Well, I definitely, because obviously I'm not a counselor, right? So definitely if I feel someone needs a counselor to help them, right? Or I offer them strategies on maybe exploring that with their partner, like maybe some topic conversation starters, right? And what I tell women is it's not good to do it in the bedroom. If you're going to have a difficult conversation with your partner, it should be out, again, a cup of coffee, you're out for a walk, you're moving, maybe you don't have to have eye contact. But it's so hard to bring up with a partner, right? If you're like, honey, and this is what I hear most women say, I love my partner so much. I love him so much. I want him to be able to have sex. And I'm like, okay, time out. You need to be able to have it too. But I think as physios, we're really good at saying, okay, here's a good counselor, or or I always have lots of different books, like even if it's Lori Brotto's research. So she has a really good website called Debunking Desire, and I can send Mel the link. The other book I love, which is really research based, is called Come As You Are. So what I love, finally, like even in the last 5 years, there's so many more researchers and female researchers reaching out and going, you know what, it's been too long that this problem's been put aside. So I think like Mel said, first thing is you're not alone, and that it's actually the majority of women. Like I hear it all day. I have women all the time, they'll ask me on the prescription pad, can you just write to my partner that I can't have sex for the next few months? And I'll say, yeah, I'll write you that, but let's discuss why, right? And I said, you need to plan some date nights.
Yeah.
That you're comfortable with. And again, it could be, hey, let's go for a couples massage, maybe just massage my feet. Or let's watch a funny movie together. Or let's just cuddle and not talk. Or you know what I mean? So I think there's so many intimate, and that's what sex is for a lot of people, is intimacy, right? But we can build depth of intimacy in other ways than physical, right? But I think in our culture, everyone's like, okay, it's got to be, sex time, right? But I do think really important, to reach out. And what's sad, Lori Brotto said when she helps educate doctors at UBC, like med students, she said those doctors up until now have been receiving no training really on how to ask those intimate questions. So sometimes doctors are afraid to ask the patient, and most women me too, like are afraid to bring up that discussion with the doctor, because usually the doctor doesn't bring it up. So I think for sure, if you feel comfortable asking your doctor, but sometimes you're in and out of that appointment so fast, and most women say, the doctor just is usually checking the baby, they're not checking me, right? But I think like Mel and I always talk about mental health. The World Health Organization says our sexual health is one of the most important core things we need. So, roof over your head, food on the table, sex, like it's kind of like a caveman thing, right? Like we need like somewhere safe to live, something to eat, and procreation, unfortunately, is kind of like the caveman thing. So unfortunately, when we take that off the table, a lot of our core needs are not being met.
Totally agree. And it's like, it's all just, I'm kind of like, sometimes it's just, gosh, like all the things that postpartum women have to think about. Like, do you know what my husband said the other day? Patrick, he said, we were talking about it, and he's got to know so much about postpartum just from me talking about it. And he's like, it's kind of like a guy having like a knee replacement and then getting a puppy the same day. He's like, we would never do that. You'd never just like do big surgery on a man and make him take care of a puppy. Like he's like, there's no way that we would ever do that. But yeah, I'm just sitting here kind of like, oh my gosh, like all the things like that we need to think about. But I don't think it should be something I always want to make sure people get out of this community, is that it's not like, oh my gosh, I have to do this and I have to do this and I have to do this. But it's more like, pick one thing and you will have a positive influence on other. And that's what I wanted to make this community be, is that there's not just the pelvic floor after having a baby. There's not just the perineum. There's not just sex. There's mental health. There's nutrition. There's exercise. Like there's so many things. And if you just make one change, then you will influence it all. And I think that this is just one thing that you can consider and that you can plug away with, and understand that you are not abnormal.
And even this group, so some of the research I've seen too, even if women, just a group of women together, just friends having a cup of tea together and just having an open conversation is one of them, they say in the research, is actually one of the most important things for increasing, I'm starting to feel things wake up down there. Because again, us feeling alone, especially as women, we're social beings, and we're meant to be in like that, again, cave woman community, discussing and sharing and supporting each other. Because again, if we were cave women, we'd be like, here's my baby, I'm gonna go have a nap, okay, you take that baby. But in our culture, we're all in separate houses, the garage door comes down, and then you're like stuck at home all by yourself. And so that's where I'm so thankful for communities like that, that Mel is initiating, even during COVID, even if you live in none of it, that you can get help from a group like this. And so there is so much value and empowerment and not to devalue that, but even just talking to a friend, even if you feel uncomfortable talking to, or you could be talking to a friend going, oh my God, I'm having the most amazing sex. My sex is like amazing since having this kid. And maybe like your hormones are so awesome and you're just loving being a mom and all that fertility and love. And, you know, there's some women that say that too. But yeah, so I think it's knowing there's a full range of possibility and to embrace wherever that is, that there's help if you need it. Right?
Absolutely. And that's what I was like, I will keep plugging along, even though lots of people I know will watch this and they won't necessarily comment. I won't know that you watch it, but sometimes I hear from you. You come into the clinic and you say, thank you so much for talking about this because no one else talked to me about it. And so I think that's why we all keep plugging along, even though we don't necessarily hear from you. We're pretty sure you're listening, and please feel free to reach out to myself or Corrine. I'm going to get you to, after I record or after I post this, I'm going to get you to put a bunch of your links at the bottom so people can find you. Okay, Corrine? And please do comment after you watch this, something you learned, something that resonated with you. It really does help us decide what other types of content to put in here. I know Corrine's willing to talk about other things, like moving on from this conversation, whether it be that we start to talk about being a bit more adventurous with sex or other things related to sex. I know I'm going to call on you eventually in the future, but please do comment or message me if you feel like there's anything that you want us to expand on this topic.
Oh, I forgot this.
Oh, yes. Do you know what I might do, Corrine, is I just want to be respectful of time because everyone always tells me they want me to keep these short and sweet. I might post it. I might take the video that you used and I'll post it in this week. And so people can watch that because I think that that's something good to know too. Yeah. So I think maybe we'll post that after this one. Does that sound good? Anyways, thank you so much for your time and your wisdom.
Oh,
And I
you're
thank you
welcome.
for always being such a great resource.
You're welcome. And I think too, it's important, you know, sometimes in these groups, we just assume everyone's partner is a male. So I'm always trying to remember that there's, so some, you know, as physios, we're trying to learn to say, okay, if you're a person that has a vagina, or you're a person that happens to have a penis, right? Or you're in a relationship where your partner's a female. So that may be introducing a toy into the vagina. So please know that when Mel and I talk about putting things into orifices, it could be a toy, it could be a finger.
Totally.
Yeah.
Absolutely. Absolutely. I think that's an important point to make. Anyways, you guys, thank you so much for your time. We hope that you learned, and we'll see you again next week. Thank you, Corrine.
You're welcome.